You've got questions, we've got answers.
And I think that makes your pathway to university a lot easier.
The brain,
A voice.
Especially the first year if you pick the right subjects in year 11 and 12.
Information.
Here, and those signals run down through the spine.
Here
They
in
then
our
exit
studio,
from these
we'll be
spinal
bringing you
nerves,
the
which
answer
can
to
see
these
through
questions and
here.
more.
Spinal nerves.
Join us for InfoMate. Assalamu alaikum and welcome back to Australia for another episode of InfoMate. In Australia, around 42% of children experience tooth decay and around 30% of adults experience some form of tooth decay as well. Now when you think about it, that's extraordinary figures for people who in general won't go to visit the dentist unless there's something wrong with their teeth. And that leads us to preventative dental checkups and leads us to today's topic of oral health and hygiene. Today we're joined here today by our guest, Dr. Khan. Thank you very much for joining us today.
Thank you for having me.
Can you tell us a bit about your experience in your profession?
My experience starts off with I was a dental hygienist and oral health therapist for a couple of years. So I worked as a oral health professional for 2 years, around 2008 to 2010.
Yep.
Then after that, I completed my Bachelor of Dental Science degree, Charleston University in Orange, and qualified as a general dentist. Whereabouts now I work for Western New South Wales Local Health District in the past the Blue Mountains region.
Yeah, country New South Wales?
Yes, and this is my second year going at the hospital, and I work in the public general dental health area.
Excellent.
Yeah.
When we talk about oral health and hygiene, what do we mean? Can you give us a bit of a definition on that?
So oral health is very important because it's a vantage point towards your general health. In the mouth, there are hard tissues, the teeth, and soft tissues. So your gums, your tongue, the back of the mouth, the roof of the palate, and these are all populated by over 500 species of bacteria.
Wow.
And so having a proper oral hygiene helps keep these bacteria in check. If they are not, they have been linked significantly to major general or systemic diseases. For example, diabetes has been linked strongly, and also AIDS and HIV.
Wow. So this is all stuff that you can find in the roof.
You can detect markers in saliva produced in the mouth.
Yep.
That can link a person's general health and detect these kind of conditions. And there are also saliva tests and kits being developed as a normal diagnostic test, potentially replacing blood tests.
Yep.
To diagnose medical conditions.
Wow.
Yes.
So it's more than just brushing your teeth. You're looking after your general health as well.
Yes,
Just taking
yes.
care of your
Correct.
teeth and your
Yes.
mouth.
Yeah.
Now, we talk about most people would assume that when we talk about oral hygiene, we're just talking about our teeth. Now, you mentioned that it's a bit more than that.
It's about how the behaviors, the habit associated with looking after your teeth. Yes, It is in part very simple steps, brushing your teeth and looking after your soft tissues.
When we say soft tissues, what do we mean?
So we mean when we talk about, in general, in my profession, as I've observed patients, people that have come and seen me, they will say, I will ask them, how do you look after your oral health? They say, I just only brush my teeth. I said, okay. I say, then do you brush your tongue as well? That's an important part of looking after the whole, keeping the whole bacterial population in the mouth in check.
Yep.
So that's what I mean. So soft tissues, cleaning your tongue as well, and your teeth as well.
Okay.
Yes.
Now, when we talk about teeth and teeth decay, I mentioned around 40% of children have
Yes.
some form of teeth decay. Why is it so important for children to look after their teeth?
It's important because if kids start having, for example, tooth decay at an early age, it almost is a precursor to them getting tooth decay when they have their permanent teeth. This is, in some cases, this may not happen, but generally speaking, there's an indication that there's a certain level of bacteria in the mouth that, with the other behaviours of the person, of the child, is already causing decay on their baby teeth. And it's just a certain specific type of decay-causing bacteria or gum, like other oral disease-causing bacteria that will populate this mouth. And over time, if the child doesn't practice it, then there's run the risk of increasing the same kind of, for example, tooth decay when they have their grown-up teeth as well.
Okay.
Yeah.
And so, should the children be doing something to look after them, just apart from brushing their teeth? What are some of the things that they can do at home?
So recently, if we look at the data, particularly in Australia, there is a report by the Australian Institute of Health and Welfare, 2014, which looks at data that goes across a span of 20 to 40 years. Going back to the 70s to the early 90s as a period, and then from the 90s to roughly about 2010. And what the data kind of shows that there was an increase of these tooth decay levels in kids around those earlier periods.
Yep.
And then towards the early 90s, it started going down. So that was the introduction of fluoridation, more focus on oral hygiene, cleanliness, and more awareness of sugars and acids from foods.
Okay.
However, recently the trend seems to be, the data seems to be showing that the trend's plateauing, and it's actually kind of heading towards a negative direction.
It's getting a little bit worse.
So it's getting a little bit worse, and one of the reasons for that potentially is that the availability or the access of sugars, particularly that the kids are getting access to.
Yeah.
And that is seemingly tipping the balance of developing decay and not developing decay. So that's what's happening, the increase of sugar and acids in foods and drinks that are available these days.
They've got much easier access to all the sugars and acids, like you're saying.
There's easier access, they're cheaper as well.
Yep.
And kids are active and they need the sugar, and by all means, but within a moderation, within a controlled amount, of course. So
is the government doing anything to help promote dental health in children?
There is the Australian government have got a child dental benefits scheme, which helps encourage kids under the age of 18 to go for regular dental checkups at least twice a year, and they can go to any dental practice, whether it's in the public sector or the private sector, and just get a checkup done, completed
for free.
Yes, there's a cap, I believe, and the cap generally does cover like a regular checkup. So if there's anything further, then the treatment costs are modified accordingly.
Excellent. Yeah. Now, we've covered children. Now, adults. We mentioned that most people won't go to the dentist. I know I haven't been to the dentist in a while.
Yeah.
So, why should adults be going to the dentist, and how often should we be going?
Like I said previously, because it is an important part of general health,
yeah.
And there's a lot of simple things. Going for a dental checkup is a very simple part of looking after yourself, okay. Because there are common conditions that, as we are all grow up and become adults. The mouth, the oral cavity, the appearance, there's a lot of psychological aspect to it as well. You need a general and functioning, good set of teeth, yep. And be able to speak, be able to function, be able to chew food, things like that. So
in the patients that you've been treating,
yeah.
What are some of the trends that you've noticed?
In my particular area, in the public sector, the demographic of people that I kind of see is that they have had limited access to dental services, and because we allow them through their concession cards be able to access the dental services that the government provides, I've noticed a trend of missing teeth quite a lot. Quite a few quite significant teeth with dental decay, caries as we call it, and there'll be significant decay. There'll be quite a few acute cases of swelling, intraoral swelling, extraoral, so inside the mouth swelling like abscesses, things like that, outside of the mouth, so facial swellings and conditions like that as well. And it's just, and majority of the hygiene, majority of the conditions can be solved with just proper oral hygiene. And people just are not being made more routinely aware of it or educated over and over to be able to stay on top and minimize these disease outcomes.
Do you notice a difference between men and women? A lot more frequent visits or anything like that?
Going back to the research, the data report, it does state that, and I have noticed this trend myself in the surgery as well, that more women will come to the dentist for a checkup compared to men. And because more women come, if they have children, they'll bring their children as well. And that kind of helps increase the data as from their to represent their cohort. Whereas men will, majority of the time, will present if there's a significant concern, usually toothache.
Okay. And we talked about food and drinks. Now, can we go into more detail about that? So, are there good foods and bad foods for your teeth?
There are good foods and bad foods. Simply, just to put it simply, it's the simple sugars that the simple fermentable carbohydrates, as we call it, if it's constantly present in the mouth, the bacteria that are there will use that to produce the acid. So it's that acid which starts to dissolve the enamel structure or the hard tissue structure of the teeth, which then subsequently leads to cavities, holes, or decay, caries as you call it. So you have a lot of foods which are like sugary drinks, soft drinks. You have sports drinks which have high amount of added sugar in it.
These are all things that kids see
and majority of it is processed or packaged foods, which an individual just needs to be a little bit more mindful of or aware of assessing the nutritional quality of it. Sure, if you need that quick sugar hit, fine. But if it's a routine, ongoing behavior that is detrimental to the hard tissue in the mouth, namely the teeth.
And so with foods, is there any high sugar foods or high acid foods that are bad for your teeth?
I suppose the confectionery, you can go back to your confectionery, high sugar content like chocolates, snakes and things like that.
Are they just as bad as drinks then?
Yeah. They are. As long as they're staying in the mouth, they're not getting cleaned or neutralized by anything, and they will cause significant damage. However, it's the frequency of it, because people can still have their treats, but it's just the frequent snacking of it, which just causes the acid levels in the mouth to stay in the mouth in that environment for a sustained period of time. And anything below what we call a critical pH in the mouth, which is 5.5, if that falls below, then the hard tissue ions of the enamel starts leaching out, which is. But having said that, there are fruits and things as well. People will have lemons, oranges, things like which are still have sugar. So there's natural sugars and acids as well. It's the same principles still apply. It's just we don't want
Just want to minimise the frequency of the
the
sugars
frequency. That's right, the frequency.
So if you've had something sugary, you had a chocolate bar in the afternoon, is there something you can do? Can you rinse your mouth? Can you brush your teeth?
Generally, what I would tell people when they ask me that question is, if you're going to have a snack, just have it then and there, finish it quickly, and avoid, taking a bite, then going away for 10, 15, 20 minutes, then coming back, taking another bite again, because then you're just not allowing the saliva in your mouth to neutralize the acidity.
Okay.
So that'll be the first tip. The second tip would be try and reduce your frequency of, try and find nutritious alternatives.
Yep.
And we've got, water is a very, very important neutralizer. So if you have something like bottled water, generally in Australia I think in New South Wales it's more than 97% of our water is fluoridated. So I would recommend use the tap water and just simple rinsing. Will just help neutralize it.
Okay.
There's also sugar-free gum. People can, if they're averse to, chewing a bit of sugar-free gum, it's got sugar, like a sugar substitute, which is not linked to dental decay. They can use that. They'll just help. The reason you want a sugar-free gum is to just stimulate saliva to neutralize that acidity in the mouth and reduce the risk.
When we talk about eating these sugary foods and the chances of getting tooth decay, what do we mean when we say tooth decay? Is it chipping, rotting, breaking? What happens to the tooth itself?
So it's a broad term for a progressive or a chronic kind of condition that happens. So it happens over time. So it's like you've got an empty glass and you're putting Coke in that glass, and then you put a coin in there. And over time you'll find there's no coin, like it's dissolved away. So it's kind of the same principle. Decay happens when there's a constant acid present, and there's calcium phosphate ions, hydroxyapatite ions, which is what the enamel structure is made of, that gets compromised. So below a critical pH, it starts leaching out. So the chemical composition of the enamel starts getting disrupted because the acid is causing that to happen. And so because of that, the physical structure starts getting affected. So it starts off with a little bit of like a white kind of chalky appearance, and then slowly starts getting discolored. And as that chalky appearance, wine starts leaching out, then it just basically starts crumbling, and then eventually forms a hole. And then over time, if left alone, if there's no symptoms, no pain, no sensitivity, it can become, it can disintegrate into more, and which can become a bigger cavity, or a bigger hole, as you would say.
So then it just leads to further problems. So it happens over something happens over time.
And then it kind of basically progresses on to the second layer dentine, which is much more softer, and that gets exposed. And once the acid or that disease condition progresses there, it just spreads at a more quicker rate. And it happens more quicker in kids' teeth than adults' teeth.
All right. So when we talk about brushing our teeth and taking care of our teeth, I mean, we've got some goodies here in front of us. Can you tell us some tips and techniques on how we should be brushing our teeth to prevent these issues from happening?
So basically, when I go through the oral hygiene instructions with people, I just try and make sure it's simple for them. It's a very simple preventative procedure that anyone across any demographic can do to just basically maintain a healthy mouth. And basically for kids, they'll have their toothbrushes, which is small head, small handle, but generally they should have soft bristles. And the same applies to the adult's toothbrush. So for kids, basically it's simple instructions. I've got my model here. So just hold it like that. Just hold it like that. So I'll say there's front, top, and back. So basically, any kind of sweeping motion, like that, or circles. If you can get them to do circles, that's great. But any kind of motion that just sweep up, and then sweep at the back, and then brush at the top. So all across. All right. And this, for adults, basically, it's just there's a few techniques. one of them being a modified bash technique, which is basically states you got to angle the bristles where the gum margin meets the tooth surface, so you're going at an angle there, and then you just circle, sweep up, circle, sweep up, circle, sweep up. Same on the inside. At the front you can kind of go up and down, but you do more circles and sweep up and forward and back on the top surfaces. So yeah.
You don't want to be going back and forward?
So yeah, so avoid anyone, yeah, so please try and just avoid going back and forth, because you're kind of creating, people will use force with their hands to brush their teeth, so that force is quite a bit of force, and people have kind of sheared off the enamel surfaces. Okay. It's called abrasion, so you're abrading your teeth.
Yep.
Abrasion lesion, so you're abrading your teeth by that action. So the more rounded actions, or up and down, more sweepy actions across, will just help dissipate the pressure and the force, and will effectively clean your teeth. And you don't need to apply too much pressure either.
Okay.
A lot of people will try and really scrub their teeth, and in doing so, the side effect is they shear the enamel away, which is not ideal.
So apart from brushing your teeth,
Yep.
should we be flossing our teeth as well?
So we should be flossing, and flossing if you can, especially after meals,
Yep.
if it's allowed. So there's a certain type. So I show people to do it like this. So
Yep.
loop it through your middle fingers. So if you demonstrate on our model here, yeah. And then you're just basically sliding it across down there, and then up there, and down there, there. So this is just a brief demonstration. There are so many videos, if people look up on YouTube, for kids as well particularly.
Yep.
There are techniques that are visually, that can show people how to clean the teeth, but the principles stay the same. So more rounded actions for adults,
Yep.
more sweeping up and down for kids.
Okay.
Avoid going back and
Back
forth.
and forth.
And then for floss, obviously, try and slide, so you're gliding it in
Yeah.
between, so you're not, pushing it through the gums and down,
Okay.
trying to hurt your
We've
gums.
got some mouthwash here too, and the TV will have you believe that it's a 3-step program. So should we be rinsing our mouth after?
So before I proceed on to the mouth rinse, we haven't talked about toothpaste. So,
okay. Yep.
so with the brushing, for kids, it's usually, if it covers their bristles,
Mm-hmm.
significant amount, they say 2 centimeters. Some say pea size for under 6 years, but as long as it's a fluoridated toothpaste, so under 6 years generally a pea size, and then over 6 is generally they can go to an adult size toothpaste and is about, say, 1 to 2 centimeters. As long as they put that, use it. And the thought is, I'll promote, is what we call spit don't rinse. So when we brush our teeth, all the foam develops in the mouth, then you spit that
So you don't
foam
want
out hygienically, obviously, and then you don't rinse. So whatever residual toothpaste that gets left behind, the fluoride in that toothpaste will just help keep things, keep the enamel, get all the ions that probably have been leached out during the day, from foods, acid, sugars, etc. The fluoride will just help negate that and try and bring those ions back. And re-strengthen the enamel again. It's a very simple and effective technique to preventing getting further tooth decay in your teeth. And the mouth rinse. So mouth rinse, personally, I believe it's more of to use as a mouth freshener. It's not a replacement for what we've talked about the brushing.
Yep.
The key things is, in the mouth you have plaque that forms, and that plaque has got a colony of bacteria there, which is like their little houses that create around the teeth, and then basically when you have the substrate, the sugar acids come in, they just work well together to start doing the sugar. The mouth rinse is, so you need to physically remove it, so that's important. So flossing agitates the plaque in between the teeth. and brushing will help agitate and further remove plaque away from all the other surfaces. And mouth rinse, if you have, for example, bad breath, that's when I'll recommend people to use just a general mouth rinse just as a mouth freshener.
Okay.
It's got limited effects,
Yep.
but there are certain individual cases for people who have gum disease where there's a specific type of mouth rinse,
Yep.
more of a medicated mouth rinse that they can use to use as part of their oral health regime.
Excellent.
Yep.
So if we don't look after our teeth properly,
Yep.
And you get people to come to you, what are some of the diseases of the mouth they can develop?
So diseases of the mouth, like I said, tooth decay, there's gum disease. Gum disease can be classified into gingivitis, which is just your generalized inflammation. That's when people will start to have a concern or complain about bleeding gums.
Mm-hmm.
And it generally takes about 24 hours for the plaque to sit around undisturbed around your gums to start causing that effect,
Okay.
so the bleeding gums effect.
Yep.
So I will say to my patients, at least if you can, try and floss once a day. So
Yep.
that agitation will just help minimize it. But that's a generally speaking kind of
Yep.
sense. There are specific cases where the other type of gum condition called periodontitis is where the gum inflammation just progresses. So you have further disease progression of the ligaments and the bone underneath and around the teeth, which get reduced due to the constant inflammation in the gums,
Right.
and that requires more routine hygiene specialists, like hygiene maintenance and specialist referrals and treatments. Yeah.
So if there's something that you can give our viewers, just a couple of tips that they should be doing each and every day,
Yeah.
what would be the message that you would leave them with?
I would leave them with basically what we've just essentially talked about, is just have a, if someone just was sitting with me like as you are right now, I'd
Yep.
say have a soft toothbrush,
Yep.
okay? I would personally say use a toothbrush that's got a small head,
Yes?
all right? It's just a normal fluoridated toothpaste.
Yep.
Brush your teeth, but I would say brush your tongue first. So you're reducing the bacterial load that gets set on your teeth, and then you brush with your fluoridated toothpaste and soft toothbrush, and then you spit but don't rinse. So, but if you are having difficulty doing that,
Yep.
if you're rinsing with water, but what I would say, just with your clean finger, just get a little bit of toothpaste, rub it around, and just let it sit for a
Leave it
few
on the
minutes.
teeth.
Yeah.
All right.
And
That's excellent.
have some wax floss to just
No,
agitate the bacteria in between your teeth. Yeah.
Brilliant.
Yeah.
So thank you very much for joining us in today's program.
No worries.
We look forward to having you again to talk about some more of these topics in a bit more detail for our viewers.
Yeah.
So thank you very much.
No worries. Thank you. Jazakallah.
Now, as we've talked about today, it's very important to look after your teeth. We need to make sure that we're brushing our teeth, we need to make sure that we floss our teeth, and that we spit and we don't rinse. But most of all, it's important to make sure you get down to the dentist to get those preventative checkups at least twice a year. Thank you very much for watching. We look forward to bringing you another program from MTA International Australia Studios. Jazakallah and Khudafis.